come in at various times depending on testing lab capacity, for example. So looking at numbers by report date does not give us as full of a picture of COVID cases during their infectious period as looking at the counts by date of onset does. On the other hand, the downside is that we cannot obtain an up-to-date assessment of COVID right now at this moment in our community. And so that's why we see on the graph, we've included a gray shaded box. And people with symptom onset date of August 15th, for example, may not have shown up as a case yet. And so we really have to, even for folks who look at these graphs all the time, we really have to train our minds to recognize that the cases displayed during the time period in the shaded part of the graph are likely not complete. And so let's look at the data. And looking at the graph, we can see some peaks. And as shown in the epi curve, the local mask order was implemented on July 9th and the governor's order on July 15th. And research strongly supports the ability of masks to reduce infections. So with some exceptions in this curve, we see since those orders a relative stability in the number of cases. And it's also useful to consider that we don't know what the graph would look like in the absence of the mask order as well. And now I'm going to turn it over to Christy Scheel, who will discuss new cases in Missoula.
Great, thanks, Erin. So after a period of about 6 weeks with no new cases reported, Missoula County saw a daily increase in new positive cases beginning in mid-June, rising steadily by that first week in July, peaking late July, early August, dipping slightly, and then remaining relatively static since. On first glance, these two graphs look pretty similar, but if you take a closer look, there's a subtle yet important difference. We generally post and publish raw new case data, like in that first graph, but it can be much more helpful to look at adjusting these numbers per population, as in the graph on the right. Doing so allows us to see where we stand in Missoula County in comparison to some other communities, no matter what size they are. It also allows us to utilize some of the guidance on metrics issued by CDC and the WHO when we are looking at things like opening schools or issuing new control measures. So in the second graph, our daily cases are adjusted by population and reported per 100,000 Missoula residents. And close to 4 weeks ago, we reported an average of around 4 new cases per 100,000. On August 2nd, our new case incidence peaked at 8.5, and then in the previous 10 days has since hovered around 6. As of yesterday, we're reporting 7 new cases per 100K for that 7-day moving average. And as Cindy mentioned today, we're reporting 2 new cases, and so we'd likely see that trend go down a little bit. Although it's helpful to see when and where new cases arise and to look at these trends, like Erin mentioned, there are definitely some limitations to keep in mind when we're looking at this kind of data. First, the new case counts reflect the date the test result was confirmed positive for COVID. It does not indicate the onset of symptoms or date of test. And we've experienced like delayed in test results, and that obviously would impact this number. So while new case data is really important, it's not always a perfect measurement of active disease in our community. In addition, new daily case counts can vary tremendously day to day. And as you can see on that first graph, which shows raw case counts, we see pretty large fluctuations, and that maximum number reported, our maximum number reported was 14 on August 7th, and then went down to 0 new cases on August 11th. For a more accurate overview or picture of new case data, a better indicator would be to look at that 7-day moving average, which calculates the average of the current day along with the previous 6 days indicated by that black line. So focusing on how this data plays out weekly, not daily, helps eliminate those peaks and valleys and offers a more accurate picture of the situation. And one last note on reported case counts. The state dashboard, as you know, oftentimes is reporting new cases very inconsistent with what we're reporting here at Missoula County. And you probably noticed there were some days where the state was reporting 20 or 30 new cases for Missoula, which was highly inaccurate. We've said it before and we'll continue saying it. Missoula County uses the most updated data from each morning based on positive test results received by our infectious disease team and a case investigation team. But oftentimes, due to the rapidly changing update, there's a bit of a delay. And then, as to when the state receives that and reports it. And as we've seen in recent months, the greater the numbers, the more day-to-day and hour-to-hour fluctuation we see between the report between county and state. There is some good news. The state, the Department of Health and Human Services is currently working on a new system which will allow counties to feed the state dashboard directly with updated case data and case status. This should be up and running in a few weeks and hopefully eliminate some of these large discrepancies that we're seeing in our caseload reports.
Great, thanks, Christy. From here, I'm going to walk us through an online resource for Montana that we've been developing at UM, and this has been in collaboration with numerous individuals from UM and the State Health Department. So we'll start out here by looking at a map that compares active cases and incidence rates across Montana counties. The counties are shaded by the incidence rates, with darker counties having higher rates and lighter counties having lower incidence rates. And again, these are active cases, not total. So it's also important to point out that these are average numbers over the last 14 days. Case numbers fluctuate substantially day to day, as Christy just mentioned. So we look at the 14-day averages to give us a better and more stable indication of what the case numbers have been doing over the past incubation period of the virus. These maps are also interactive. So when you hover over each county, you'll find specific numbers for that particular county. For example, hovering over Missoula County here, you see some specific numbers. The 3 indicates the shade of blue corresponding to the legend on the right side of the graph. So you also see total county population, the average number of active cases for the county over the last 14 days, and then the average incidence rate over the past 14 days. And again, this is a number of active cases per 100,000 people in the specific county. And just to reiterate, presenting incidence rates like this per 100,000 people is just a way of standardizing the numbers so we can look and compare cases across counties that have different populations. Now, for a couple of examples, if you compare Missoula County to, say, Yellowstone County, Yellowstone County has had a number more cases, and therefore they have a higher average case number and a higher incidence rate number over the last 14 days. Although Gallatin County had a peak earlier in the summer, they've had relatively low case numbers and a lower incidence rate over the last 14 days. Looking at Lewis and Clark County, they have a very similar average case number, 47, compared to 48 that you see from Missoula County. However, you see, due to their lower population in Lewis and Clark County, they have a higher incidence rate over the last 14 days. And looking at a more extreme example, we can look at Phillips County over here that has a very small population of a little over 4,000 people. So even though they had lower case numbers over the last 2 weeks, they've had a very high incidence rate per 100,000 individuals. So this map is just a helpful tool to compare how we're doing compared to other counties around the state over the past 14 days. We have some other tools on the website. If you kind of click through here, you can look at the data and how that compares across age groups for the state of Montana. So here we're comparing incidence rate by age group, and this is for the entire state of Montana. And hovering over here and just visualizing this graph, you can see that 20-somethings in the state have a much higher incidence rate than other age groups in Montana. Their incidence rate is is around 1,500, or excuse me, they have around 1,500 cases, and their incidence rate is around 1,100 per 100,000 individuals. And if we go back to the presentation here and compare to Missoula County, you can see that the trend is very similar. The 20-somethings in Missoula County have by far the highest incidence rate compared to other age groups in the county. However, when you compare to the state as a whole, Missoula County has actually substantially lower incidence numbers than the state of Montana as a whole. The 20-somethings in Montana had an incidence of around 1,100, whereas in Missoula County, we see it's closer to 550, so nearly half of what you see across the state of Montana. Now, an important message from this figure is that younger individuals, although less likely to experience severe symptoms, they're still contracting the virus at a high rate, and they play a role in spreading the virus to others. So all age groups have to do their part in practicing social distancing, wearing masks, and getting tested, even if you only have mild symptoms. And speaking of symptoms, this next figure shows an important message when considering symptoms. So here you see the number of cases in Missoula County who have reported 11 COVID symptoms that are highlighted by the CDC. And within the bars next to each symptom on the left, the colors indicate a specific age group of the Missoula County population. So the takeaway from this is that although some symptoms are more common than others, like fever, cough, or fatigue, any age group can experience any symptom. Or in other words, none of the COVID symptoms are really specific to any age group. Anyone can experience none or any of these symptoms, really. So therefore, it's important to monitor your own health closely and get tested if you have any of these symptoms. Now, unfortunately, this is easier said than done. Most of the symptoms can be very vague. Like congestion is a common symptom, and you may have something as harmless as a runny nose, but it could still indicate that you may have COVID and could pass it on to others. So when in doubt, it's best to get tested. And testing is what really gives us the ability to do contact tracing and isolating positive cases, which is imperative in reducing the spread of COVID in the community. And from here, Christy is going to take over again and cover some community transmission discussion for the county.
Thanks, Ethan. So determining the source of exposure is one of the most important parts of a case investigation. During case interviews, the case investigator begins to piece together how, where, and when the virus was transmitted. This provides really essential information to help us understand how COVID is moving around Missoula. This is a snapshot, this pie chart is a snapshot from yesterday where we had 84 active cases. We saw a slight majority of 44% of all active cases likely acquired the virus in the community as the source was unknown and not linked to travel or a confirmed case. 42% of active cases are contacts to a confirmed case, either within the household or otherwise, and 7% of reported cases likely acquired the virus through travel-related exposures. And then again, 7% of active cases are under investigation, and the source of exposure has not yet been determined. So since early July, widespread community-acquired transmission has become more prevalent in Missoula County. This is something we like to keep a very close eye on. When we start going up, we have less control over containing the spread. Keeping community spread low really helps us manage our caseload and maintain our capacity for case investigating, doing monitoring and then doing contact tracing. When source of exposure can be attributed to having close contact with a confirmed case, that's fantastic, because it means the case has usually been identified through recommended testing early on during the infectious period, and we generally can contain it and manage it a little bit better. By looking at transmission changes over time, we can better understand how people are becoming exposed to COVID and act accordingly. Community-acquired cases steadily increased throughout July and August in Missoula County. And during the week of July 19th, we saw 29% of new COVID cases coming from community spread, peaking in early August when our active caseload was highest, dipping slightly, and then remaining relatively stable around 40% of total active cases this week. Travel-related cases, as you may recall, were much more frequent in earlier stages of the pandemic. Transmission via travel peaked in mid-July and then declined, contributing only sporadically to new cases over time. It's really important to highlight and celebrate the fact that close contacts continue to be identified, making up the vast majority of all cases reported in mid-July, dipping slightly, then rising again during that first half of August. This is a really good indicator that we are conducting timely investigations and doing really solid contact tracing. Just a word about contact tracing. There's no doubt contact tracing has significantly contributed to finding new cases here in Missoula County, indicating that our disease control efforts, like recommended testing, required quarantine and isolation, initiated by our investigation and monitoring teams, are really successful. On a side note and a lead-in to our next slide, our health department staff is currently monitoring over 314 close contacts to confirmed cases. Since the beginning of the pandemic, our staff has monitored over 2,000 close contacts. And although these numbers sound really impressive, we actually want to see and keep these numbers really low. And that would be an indication that confirmed cases are keeping their circle of close contacts to a small number. The importance of maintaining a small number of close contacts cannot be overstated. It really helps us slow the transmission down and increases our capacity to manage and monitor our current caseload.
Great. Thanks, Chrissy. And so in this table, we're looking at the contacts for cases in Missoula County, and that's divided up by different age groups of the cases. And similar to the case numbers and incidence rates, younger individuals in the county on average have higher numbers of contacts. So you can see that kids in their teens, as well as 20, 30, and 40-year-olds, all have on average 5 or more contacts per COVID case. And these are also the groups that have the highest maximum number of contacts. And at least one individual in each of these groups has had at least 40 or more contacts that had to be traced. So this is yet another reason of practicing careful social distancing, wearing masks, and reducing the social group that you're interacting with. If we can reduce the average number of contacts, it will make that contact tracing easier and slow the spread of the virus. Now, in the next few slides, we'll cover a specific measure of the spread of the outbreak called the reproduction number, sometimes called R number, R value, or simply R. Now, R is the average number of people who are infected by a known case of COVID. If R is greater than 1, the virus will continue to spread. If it's less than 1, the spread will slow. Now, R is impacted by a number of factors, including the contact rate or the number of contacts by a case, the probability of transmission, and the duration of the infectious period. When calculating R, we use another number called the serial interval. And the serial interval is the number of days in between the symptom onset of a case and the symptom onset of the person that they infect. Now, the serial interval can vary, and in order to better represent the spread of COVID in a state with a low population density like Montana, our group has used pairs of cases from Montana to calculate a Montana-specific serial interval. And we use this number to calculate R values for Montana that help us understand how quickly the virus is spreading in our state. Now, we report R a little differently than some sources. We use the date of symptom onset for cases as opposed to the date of positive test result. The symptom onset, as we've described, it can give a more accurate count of daily incidents than the date of test report. And due to variations in testing and reporting the results that change depending on when testing procedures are done and day of the week. So we use the date of symptom onset, and the latest R value we can really report then is from about 2 weeks ago. And since cases in the past 2 weeks may not yet be reported, and the daily case numbers during that time might be inaccurate. We also report R on rolling 14-day averages. So for each date, the R value is an average of the R value from the previous 14 days. In this figure, you can see that R for Missoula County is since July 1st, and there have been some fluctuation, but R value has generally stayed close to 1, indicating the spread of the virus has been relatively stable or even slowly dropping. We can also use this plot to try to look at the impact of interventions on COVID cases. So for the example, the Missoula County mask mandate went into effect on July 9th. And due to the 2-week incubation period of the virus, you really need to look forward to see any potential impact of that mask mandate. The Missoula County R value went up for about a week after the mandate, but then began to drop and has fluctuated around 1 in the most recent weeks. While this is encouraging that cases and R values have not spiked recently, there are really 2 big points to emphasize here. We can't develop a false sense of security and stop wearing masks or social distancing, or things will get worse. And also, we can't say for sure what impact the mask mandate has had, because we will never really know how many cases there would have been without a mask mandate in place. So while the best scientific evidence says that community-wide mask use does work, masks are one of the most important tools that we can use in keeping COVID under control in our county. We also report R values on the website for the state, the 5 health regions, and the various counties that have had higher numbers of cases. And this allows us to compare cases and R values between different areas of the state. So in general, for Missoula County, the R value peaked late June and has fluctuated around 1 over the last 2 months, but overall has been relatively stable with no extreme periods of growth or decline, really. Compared to the state of Montana as a whole and other similar sized counties such as Gallatin and Yellowstone, R values for Missoula have generally been lower and more stable over the past 2 months. And these overall signs are encouraging, but we do need to remember we're about to encounter new challenges for the fall school year and as we head into cold and flu season. So we have to remember this is not a time to develop this false sense of security, but to continue wearing masks, to continue practicing social distancing, and keep the spread at a minimum as we encounter these new challenges. And one last point we want to emphasize about R values is they can change dramatically over time and depending on how the number is calculated. So the top figure in this plot, and this is from a resource called RT Live. So these are not numbers that we calculated, but they are calculated consistently across each state. The top figure shows currently estimated R values for all US states. And the figure below shows R values for the same states in the same order, but 3 months ago. So comparing these 2 figures, we show that how dynamic COVID can be over time and how different it is by state. Some of the states that now have the lowest R value, well, they had some of the highest numbers 3 months ago. And in contrast, some of the states that had the highest R values currently were lower 3 months ago. So again, the key here is consistency. These numbers can and will change, and we have to remain diligent in our public health practices to keep COVID from spreading more rapidly throughout the county and the state. So with that, Rebecca is going to cover some information on testing within Missoula County.
Thanks, Ethan. So what I'm about to go over is a broad look at testing here in Missoula. And the test positivity rate is a useful measure that compares the total number of positive test results to the total number of tests conducted. And I should distinguish that the measure is, the figure is measuring test events generally and not individual patients. So in the United States, the positivity rate is hovering just below 7%, which may include duplicates or multiple positive test results from a single patient. If you go to the next slide, Ethan, we can see that in Montana, the positivity rate is very similar. It's hovering just below 7%, which could include duplicates. And if we go to the next slide, we can see how the county of Missoula measures up to the state and the country. And we're quite a bit lower. Last week, the positivity rate was just below 5% at 4.77%. And this graph is showing weekly snapshots of the positivity rates since March. And as I mentioned before, the positivity rate ties a string between the total positive cases and the total tests conducted, which you can see in blue. And high test positivity rates indicate the need for more testing. Either there are too few tests or there's a lot of spread that's going on undetected, or both. And by contrast, a low test positivity rate indicates high public health capacity, an adequate response with testing, and more importantly, rapid case identification, which is necessary for reducing spread. And I'll mention here as well that 4.77% last week, we have been in the county to understand the most accurate picture of the disease in the county. We are adjusting that figure for duplicate positives. So we're removing duplicate positives from that figure. And what we're also doing, like Christy mentioned, there have been some periods of delay times between getting test results back and received by public health. So when we see test results that come in with the test having been over 2 weeks old, we're also adjusting for that in our figure. And if you go to the next slide, we can see some greater depth, the daily positivity rates from last week. And finally, I'll go over one more reason we are making counting duplicates a priority, which is to understand how many Missoulians are being tested. So after having removed duplicates, people who are testing multiple times, we can see that 12.5% of the population here in Missoula has been tested at least once, which is absolutely something to celebrate. What this figure doesn't tell us is who's getting tested or who has access to testing or who doesn't. And with that, I will hand it back to Erin.
Thanks very much, Rebecca. And so some closing thoughts here. So the data we presented today on new and active cases, as well as the data on R values, provide evidence that the overall status of COVID in Missoula County is relatively stable. We saw signs that improvements are possible through policy and behavior change, but also that in the absence of a vaccine and treatment, gains and stability that we see are fragile. We do not need to look beyond our own state to know that that is the case. We still need to keep our number of contacts as low as we can and keep wearing our masks. And finally, so that we can effectively implement the contact tracing and isolation of cases, these are the cornerstones of the public health response during a pandemic. It is critical to continue the efforts that we know many are making to expand testing in Missoula and in our state. And with that, thank you for listening, and we're happy to take your questions.
Thanks, everyone. So yeah, we can open it up to media questions now. If we could keep it focused on just the presentation and the information provided here, that would be helpful. Cindy will have her regular media availability later this afternoon if you have other COVID-related questions. And with that, I believe everyone should be able to unmute themselves if you have a question, but we'll figure that out if not. So, are there any questions from the media?
Yeah, this is Cameron Evans with the Missoulian, and I was just curious how rapid testing is playing into this, if that's not too off topic.
That's a good question, and I can start with an answer there, and Christy and Cindy or Ellen, please jump in. My understanding is that the rapid testing has just started on one of the mobile testing units, but they are counted as positives. But that is a recent development. And then I believe the rapid testing at the county site is very soon going to be underway.
Yeah, so I'll just jump in and say, yes, that's correct. I would turn it over to Rebecca to talk about how if that data is being collected on the rapid testing that's happening at other healthcare facilities. But when it comes to our own facility out on Flynn Lane, we are very soon going to be able to have the ability to do rapid testing. We're hoping possibly by sometime next week. So, and we will be counting that data as well as the PCR testing.
Yeah, that's a great question. I'll add to Cindy's answer and say that the data that I'm using to collect those testing numbers are through the state, which do count all tests performed. So we are seeing which types of tests are coming in from which types of instruments. So that is something that we, thank goodness, have a good picture of, and we're in transition to see more of.
Awesome. Could I have one quick follow-up? I was just curious if you mentioned that there's still been some periods of delay with getting test results back, and I was wondering like how significant that is and kind of like where that's at compared with, where it was a few weeks ago.
We're seeing fewer and fewer delays in the lab. So thank goodness it seems like we're really getting out of that hole. And during that period where there were significant delays, we can go ahead and look at when the specimens were collected and when those results were received by public health. And we're taking that especially into account with positive cases and looking to see how delayed those positive cases results are coming in. So this past week, for example, we had one positive case where the results were, basically 2 weeks late. So we have a clear picture of those delays at this point in time, and we're seeing less of it.
I'll just chime in and say the bulk of those delays, the test results that came in, really, we started seeing them that first week of August, which is when we saw a little bit of a peak in active cases. However, many of those cases, by the time they were delayed, a couple weeks, maybe 10, 14 or more days, many of them were out of isolation and recovered by the time they actually became a case. We are no longer seeing that, but during that period of time, that chunk of that first week of August, about 15% of our cases, our new cases, were actually from that delayed testing situation. But currently we're seeing test results come back in 2 to 3 days.
I have a couple questions. You guys showed the RT Live website, and I'm wondering if you think that is a legitimate website to go to for, like, do you think it is accurate in representation? And also, it shows Montana's R value has been high kind of throughout this, and I'm wondering if you can explain why Montana's R value has been higher than some states.
Yeah, I can start on that, and anyone else feel free to chime in. But first question I think was if that's a good website to go to, and I think, yeah, I would recommend going to a number of different resources. And as we mentioned, there are different ways to calculate these numbers, and they're just different methods. So looking at different resources and comparing those and kind of getting an average idea of what the numbers are saying, I would recommend that over just sticking to one specific resource. And another question I think was why maybe they're reporting higher numbers for Montana in particular. And that can just come down to the methods that are used. The the RT Live website uses the date that the test numbers are reported, and whereas the numbers we use are date of symptom onset. So that can have an impact in some of the numbers. Another thing that can impact is, as I mentioned in the presentation, is the serial interval that you use to make the R calculation. And we have used a serial interval that is specific for Missoula, or for Montana, excuse me, specifically. Whereas other methods of using this, other individuals who calculate R are using different serial intervals that have come from other studies, other states, or even other countries. So I think we have improved upon that method for Montana specific numbers. But did that more or less answer most of your questions?
As much as my non-scientific brain can wrap around that, yeah.
So yeah, there are a lot of different ways to do that, but what we're trying to focus on in our group is calculating numbers in a way that makes most sense for Montana itself.
And then on that last slide, you talked about just wanting to see further expansion of testing opportunities, and I'm wondering where you think our testing capacity should be versus where we are now. Like, what in an ideal world, where would you like to see Missoula County's testing?
This is Ellen. I'd like to get us back to where we can actually do more surveillance testing. And as you know, Missoula was one of the counties that stood that up. And that is one of the factors that contributed to the overall lab capacity being overwhelmed, not just in Montana, but in other states where tests were being sent. And so the lab capacity, there's still some surveillance testing going on in long-term care facilities, for example, and those are highly critical institutions, but I would like to have more surveillance testing where we could look at different types of, we could look at schools, or we could look at different types of jobs with public exposure and those types of things. That was our goal. But when it took the whole system down, we had to suspend that. But there are countries that are able to do that, and the US right now is not among them.
Ellen, do you see us do you see it kind of turning the corner? Do you see us working that back up, or are we still just?
I really don't know what the federal plan is, or if there's a plan. I know that the state of Montana had a plan and we locally had one. But without that information from the federal passed through the state to local, I really can't predict. I also, if our planning assumption is, even with all of these controls that are, that are working, we have a lot of challenges with more people in the community. We have the fall coming up. Some of the experts, such as Dr. Fauci, are saying, plan for a bad fall and winter with other respiratory diseases. So even if we did get more of a green light on a more comprehensive surveillance testing, we might again be challenged by the fact that our priority testing has to be symptomatic and close contacts. So it's really hard to say at this point.
Do you have any questions? Oh, go ahead.
Sorry. This is Katie with KPAX. I just wanted to go back to discrepancies between the state and the county reporting. What exactly is going to be changed and when?
I can answer that. From what we understand, there's currently they're trying to operationalize a new process that would allow counties, it's happening everywhere across Montana with all counties, not just Missoula, but it will allow each county to basically feed that data dashboard directly and upload new case status pertaining to recovered, active, new cases that maybe they're not capturing. And that will be something that it will be more in control by the county itself. That, from what I understand, is in process, and counties are trying to update and get on board with this, and that should be in the works in the next couple weeks.
Hi, can you guys hear me? This is Stella Sun with ABC Fox. I'm using my colleague's Zoom account because I'm having issues. I was wondering if you guys have broken down, I know Missoula County, it's pretty expansive, and there are more rural parts of the county, such as like City Lake, which is a big tourist destination. Are you guys finding certain areas within the county that are seeing, I guess, higher case numbers, if that makes sense? Like, I'm just curious. And, you know, Sealy's just a big tourist hub for a lot of out-of-staters. Are you guys breaking that down?
So Stella, you are very, very quiet. It's really hard to hear you. I think the part that I caught was you wanted to know if we're seeing increased numbers in any particular area of the county. And I can answer that question. We're seeing COVID-19 in all areas of the county. Obviously, the areas that have a larger population base are going to have more cases, but it's pretty widespread. We're seeing it all over the county. And I could not quite hear what the rest of your question was because you are very quiet.
Sorry, I was just wondering if, you know, for example, like Sealy Lake is still part of Missoula County. It's a big tourist hub. So you're just still seeing across the board in Missoula County, just, I guess, pretty similar numbers. Can you still hear me? Sorry, I don't know if you can hear me.
Yes, yeah, we're just seeing it pretty similar. I mean, it's just pretty similar, widespread throughout the whole county, including all stretches of the county.
Thank you.
And I would add to that, if you recognize that the political boundaries don't mean much to the virus, although there may be different populations and different control measures. We have some stringent control measures here in Missoula. If you went back to the chart that Ethan was showing, where you can compare the incidence for each county, you'll see that Lake County is a little bit higher than incidence in us, and River Valley is a little bit lower, but regionally we're kind of in the same boat. And so that kind of supports what Cindy's saying, is the virus is spread pretty far and wide in our region, and pretty evenly in our closer region of like a 3-county region.
Thank you.
Do we have any other questions? All right, well, thanks for joining us, everyone. Sorry about the recording issues. We did record it on our end, and so I'll send that out later, and I believe Cindy is going to post that on our YouTube channel too, so we'll get that to you.